Hello, my name is Caitlin Gillespie, and I'll be going over the moral right to healthcare. I am the current compliance officer here at the hospital. This briefing, I'll be going over the moral right to healthcare, code of ethics, code of conduct, bioethic principles, resource allocation, and the references used. Moral right to healthcare. As a nation, we have come to regard healthcare as something of a moral right. You see this belief put into place within the three following healthcare programs: Medicare, Medicaid, and the Patient Protection and Affordable Care Act of 2010. Medicare is for citizens of 65 or older who have end-stage renal diseases and also may have disability. Medicaid is for our citizens below a certain income level. The Patient Protection and Affordable Care Act of 2010, you see this belief put into place strongly in this program. This program is to make sure that all Americans have access to health care and or have adequate health care. Code of ethics, code of conduct are more than rules, they are virtues. They serve practitioners facing ethical dilemmas, give shape and structure to our moral environment, and summarize our ethical position, outlines the mission and values of the healthcare organization, how professionals are supposed to approach problems, ethical principles based on the organization's core values, and the standards to which the professional will be held. Please note, the values, mission, and vision statements all deal with what's important to us and what we do, whereas the code of conduct deals with how we interact with each other. The vision statement. This is the inspirational, aspirational statement that defines where the organization is headed in terms of both actions and identity. The mission statement documents the attempts to operationalize the goals set forth within the vision statement, mission statement, should reflect the underlying values articulated within the organization's value statement. And the value statement documents the attempt to identify organizational goals, principles, and commitments. Values, mission, and vision statements, along with the code of conduct, serve to establish an organizational culture, as well as define the control the organization. The code of ethics, code of conduct relate to the moral right to healthcare, by our duty as medical professionals to serve those in need of medical attention no matter what, which is seen specifically within the bioethic principles that each professional must follow. Now, as you see in the diagram, all four of these bioethic principles intertwine together, connecting. There is autonomy, which is defined as self-determined, which you see an example: informed consent, confirming that the patient is aware of the exact procedure, benefits, or risks. Non-maleficent, the general duty to avoid causing harm to others. Benefits is the ethic that requires physicians to do good and provide charitable duty to others. Justice. Justice is broken down into two different sections: distributive justice, which refers to allocation of resources, and procedural justice, which refers to the fairness and transparency of processes by which decisions are made. Resource allocation. There is a moral obligation for leaders of healthcare organizations to meet the healthcare needs of patients and communities. This moral duty cannot, in many instances, be met perfectly. Now, since they can't be met perfectly, we need to make sure that everyone is giving their best effort to make sure that the quality of care is not lowered, while sticking to our code of ethics, conduct, value statement, and mission statement, and our vision statement. As stated prior, justice is broken into two categories that both apply to resource allocation. Procedural justice is broken down to four approaches to resource allocation: by expert panels, community consensus, lottery, and court order, and distributive justice. I went over the moral right to healthcare, code of ethics, and code of conduct, bioethic principles, and resource allocation. Code of ethics is also known as code of conduct, which outline the vision statement, value statement, and mission statement of the medical institution, which are all followed by the employees of our hospital. Bioethic principle, that is another requirement of our employees to follow, provides healthcare with excellent quality to our patients and the community around us. During difficult times when the hospital is not prepared to meet all the medical needs of our community and our patients, resource allocation must be conducted. All of these three topics have to do strong with moral right to healthcare, based on our duties as medical professionals. It is our moral duty to take care of those suffering the best way we can, said Paul Farmer. Thank you for your time.